Alright, so hello everyone and welcome back to today's webinar. So today we'll talk about the epilepsy and we'll discuss some of the epilepsy remedies today. So very interesting video this will be. So let's start with the talk today. So if you see the definition of this epilepsy, is basically a disorder in which nerve cell activity in the brain is disturbed and causing seizures. And epilepsy may occur as a result of genetic disorder or an acquired brain injury such as trauma or stroke. That thing we have to remember. And if you can see this diagram, that will make you understood all well. And this is a normal to nerve cell, and you can see the activities, and when this is hampered you can see these abnormal activities. So this is the basic difference, the abnormal increase in activity of the nerve cells. So this was it, and it's basically there are two types, the partial seizure or a generalized seizure. The partial seizure we also call it as petit mal, and generalized seizure we also called as the grand mal. Alright, so you can see some of the causes here. A stroke can be the major cause, a brain tumor, a severe head injury, a drug abuse, an infection in the brain, lack of oxygen during birth. So these are certain causes of epilepsy, and I will discuss also two of the major types of it. The generalized epilepsy, we call it as grand mal, and the partial epilepsy we call it as the petit mal. So this generalized epilepsy, actually what happened is this generalized epilepsy, there is complete loss of consciousness in this, and which causes stiffness in the body, and we call it this phase as a tonic phase of the seizure, and then the violent severe jerking of the body, and we call it as a clonic phase, the tonic phase and the clonic phase, after which the patient goes to sleep, and we call it as the postictal phase and after seizure phase. That's the major three phases we have to remember in order to understand this. And during this grand mal seizure, the injuries or accident may occur such as tongue biting or urinary incontinence. So these are the certain things which can be done. Also now we will discuss about the partial epilepsy classification. The partial we also know as petit mal, and petit mal you can see some of the symptoms of it. The motor symptoms include the jerking, stiffening, muscle rigidity, spasm and head turning. The sensory symptom includes severe symptoms involve unusual sensation affecting any part of the five senses, the vision, hearing, smell, taste, tongue, etc. And term aura is used to describe the sensory symptoms that are present only. So these are the basic things. They are automatic, and most often which unusual sensation in the stomach term like gastric uprising. This sensation as something uprising in the stomach. And psychodynamic angels, the psychological symptoms are also included, such as deja vu and some of the emotions as well as fear and pleasure and other complex psychological phenomena. So these are all the major symptom of partial epilepsy. So move ahead now. So we'll discuss the major thing now, the remedies of this epilepsy. The first remedy of today is Miguel Lecidora. It's a remedy of black Cuban spider, and has a great role in dealing this type of seizure. Especially the spider remedies have a great role in dealing with the seizure, whether it is Theridion, whether it is Miguel Lecidora, whether it is Tarantula, all of them. And basically the major PQRS of this Miguel Lecidora is there is always a spasm in the lower limb, and whenever you see a spasm in the lower limb, think of this remedy, the Miguel Lecidora, a very important remedy, interesting drug. You can check out some rubric. Spasm, twitching, jerks, right, especially in the right side there is spasm, and convulsion, spasm, lower limb, and cannot walk due to because of this. You can check out the Miguel Lecidora is the major remedy. And main genitalia, and all the PQRS of this remedy, especially there is always the erection of the penis, especially in the man genita during the convulsion. So you can think of potency at 200 C and 1 M. If you are giving 200 C, repeat it BD for 5 to 6 days. If you are giving 1 M, repeat it single dose. 2 to 3 doses are necessary. OD for 2 to 3 days. That's it. And the second remedy is Gigia aurea, a miraculous remedy, a remedy from the Umbelliferae family. And the major PQRS, there is always a pain in the epigastric region of the abdomen along with the convulsion, and there are lots of ovarian complaints. So these are two things we have to keep in mind. There is pain in the epigastric region and the complaints in the ovarian complaints. These are two things we have to remember. You can check out certain rubric: convulsion, epigastric, benign pain with convulsion, spasm, ovarian complaints in. You can check the major remedies, Gigia aurea. And during the pupilar labor, and there is a pain cease, and you can also think of this remedy, the Gigia aurea. Interesting term. If you are giving 200, gives it OD, or sorry, give it BD for 3 to 4 days, and if you are giving 1M, give it a single dose for 2 to 3 days. That's it. And third remedy, Arenia diadema, another remedy from the spider. That is the cross spider, and it has a tendency of convulsion while eating. And dysmenorrhea is the major PQRS, is the major concomitant along with the convulsion. Dysmenorrhea with convulsion, think of this remedy, Arenia diadema. You can check out some rubrics. The convulsion, eating while, think of this remedy, the major PQRS. And there is dysmenorrhea with convulsion, think of this remedy. Very common remedy. You can remember all these points, and whenever you will remind these 2-3 points of prescribing a remedy, it will be more easier to you for prescribing this remedy. If you are giving 200, same, repeat it BD for 5 to 6 days. If you are giving 1M, repeat it OD for 3 days at most. And that's fourth last remedy of today is Ginkgo mat, a major common therapeutic for epilepsy. And the PQRS is the eye rolls. The eye keep on rolling during the convulsion, and convulsion aggravate at night and after diarrhea. These are the two things we have to remember. We check out from rubric. Fatal repertory, jerks, convulsion at night, convulsion, spasm, diarrhea after. You can see Ginkgo mat. And eye rolling convulsion in, think of Ginkgo mat. The potentiate 200C and 1M. If you are giving 200C, give it BD for 5 to 6 days. If you are giving 1M, give it OD for 3 days. So this is from the book that we have written along with Dr. Rajarshi Mishra. It's getting very good response throughout the country. I want to show you guys to all my teachers who taught me so much. You can contact to me, NISHANT@smilebox@gmail.com, and don't forget to subscribe to our channel.